Hi guys, and welcome again to Inside Guy's World. I'm Guy, and on this channel we help you improve, grow, and win in every aspect of your life. So today what I want to talk to you a little bit about is PTSD. That's post-traumatic stress disorder. Now, if you have post-traumatic stress disorder, I'm going to talk about some of the signs and symptoms that you already know about. I'm going to also talk about some of the treatments, but let me preface all of this by saying I'm not a mental health provider. I'm not a professional when it comes to that. I'm not a doctor. I'm not anybody with any of those degrees. What I am is I am an individual who has PTSD. So today, guys, I'm going to talk to you a little bit about PTSD, post-traumatic stress disorder, and what I want to do is I want to just tell you a little bit about what I've gone through, and what some of the signs and symptoms are. Now, I'm going to flash things up on the screen here that'll be able to show you, just some of the typical signs, symptoms that come up. But again, I'm not a doctor. I'm not a behavioral health specialist. I'm not a mental health specialist or a doctor or a psychiatrist, psychologist, nothing like that. I'm just a person that goes through it. I'm a person that has that same experience. And so from all the things that I've gone through, I want to be able to tell you what it's like and let you know, number one, that you're not alone. You're not the only person, right? And I want you to know that that's why we're here on this channel. I'm going to talk to you about things that I'm going through. And if you feel that you're going through some of the same things, then please go down below and put in a comment. Let me know, if there's anything that I can do. You need that camaraderie. I mean, hey, thanks. I'm not going through it. I'm going through the same thing. I appreciate any of that. And I appreciate you guys watching this. And if you're a family member or a friend and you have someone going through this, have them watch this, but watch it yourself so that maybe you can understand. And that's my hope, is that there can be an education out there that you can understand from our point of view, how we see the world. So I have a lot of the signs and symptoms that you'll see on the screen. And so one of the things that I want to tell you is that not all of these may apply. Some of them may apply. Only one may apply. So everybody's a little bit different. But the main thing is you have to get help. I've been talking to a therapist. I've been going through therapy for a while. And, one of the things and the main reasons why I knew I had PTSD was due to my anger. I was getting angry at very small things. Things that were just, most people would look at and go, there's no reason for you to be this angry about something that's just a small ordeal. But I would get angry, and I realized that it was my anger, not at the situation that was happening, but just anger at the world, at everything, at myself. And I knew I needed help. I knew I needed somebody to talk to about this that could help me work through some steps or have some ways that could work through that. So anger being a very big one, a very big sign or symptom. My wife, who's also a disabled veteran, she talks to me all the time about, hey, you're getting angry for no reason about this. Maybe you need to take 5 minutes or take 10 minutes or however long you need to relax, chill down for a little bit, do something else. And so what I've found is that all these symptoms that you see, right, these signs, symptoms, things that are typically out there, they are what you're going to see in other people, other veterans that I've talked to. It's very commonplace that there's going to be other things. Hypervigilance being one of them. I can't go out in public anymore without thinking every time I go into a crowd, every time I go to a store, every time I go to Walmart, every time I go to get my, get gas, I always think that something is going to happen and I have to be prepared for it. So every time I'm out, I'm watching where everybody is, what they're doing, how they're doing it, just keeping in my mind's eye, tracking everything that's happening within a 360 degree around me, looking over my shoulder to make sure that I'm checking my 6 and, doing the 25 and 50 meter, I just, hey, as soon as I get out of the vehicle, I'm looking. Those things are hard for a lot of people to understand. And the reason being is that I understand that family and friends don't always get why we sometimes just don't want to go anywhere. We don't want to do anything. We tend to avoid a lot of things that we used to do. And that's the main reason why I'm doing this video, is to talk to you guys about, if you see these signs, if you feel these signs or symptoms, if you feel yourself getting angry, those are the things that start to lead up. And when you're having trouble sleeping and you're already cognitively, like, you feel like you're in a fog, like you can't think straight. And then you have memory issues and, hey, I was supposed to go to the store. My wife told me to go to the store and I forgot what I was supposed to get. A gallon of milk, half gallon, I don't remember. I don't even remember if I was supposed to get milk. Maybe I was supposed to get bread. I don't remember. And then that causes anger issues. And it causes a lot of the other symptoms to start festering, start building up before it gets to a point when suddenly you're deep into depression and you don't want to get out of bed, you don't want to do anything. And I've been there. And every day I work at it. Every day. Some days are better than others. I can get up and do things. Some days aren't. But the main thing is you've got to get help. Talk to somebody. Doesn't matter if it's a battle buddy. Doesn't matter if it's, military one source. Doesn't matter. Whoever you trust, talk to them. So when you look at these therapies, you kind of see that it's not just the psychotherapy of talk therapy, which is the first thing I did. Talk therapy is one of the therapies. You can see that on the screen here. Talk therapy is definitely one. You've got then, of course, the medications that come with that, but there's education and exposure, and there's many other therapies out there. And that's what I learned from many different therapists that I've had. I've had a lot of different therapists, but it's keeping an open mind to the fact that at any point in time, you could have a therapy that may work for you. So above anything else, realize that you gotta get help. Realize that, because it's the most important thing. You have to get help because you can't do it alone. So don't think that you have to try to get help alone. You have a support system. Each and every person that has worn that flag on their right shoulder, every single one of us are your brothers and sisters. We're all here for you each and every day. And that's the bond that comes from wearing that. That's the bond. And so each and every day I want to tell you, we're here for you and you are not alone. If you've gotten any help, if you got value out of this video, like the video so that others can see it. But leave me a comment down below if there's anything I can do to be better, because trust me, this is my first video and I know it's bad. Again, subscribe if you're not subscribed and you'll see a video every week. Take care, guys.